Now let's talk about the incubation period for SARS coronavirus 2. It's important for you to learn the term incubation period because you're going to hear it throughout this course. So the incubation period is the time from when someone is infected until they develop symptoms. So usually this takes a number of days. So the incubation period for SARS coronavirus ranges from 2 to 14 days. So most people infected with this virus will develop signs and symptoms between 2 to 14 days after they are infected. You can see here on your screen the proportion of people who develop symptoms by each day after they are infected. So 5% of all people infected with this virus will develop signs or symptoms within 2 days. So it can be very quick. And half of people infected will develop signs and symptoms within 5 days. So just 5 days after infection, half of everyone infected will develop signs and symptoms. By 14 days, 95% of all people who are infected will have developed signs or symptoms. Okay, now let's define the infectious period. This is an important term that you'll need to know for the rest of the course. The infectious period is the time at which someone infected with SARS-CoV-2 can transmit the virus to other people. So for people who have COVID-19 disease, their infectious period starts 2 days before the start of their signs and symptoms. And they could infect other people throughout the end of their illness. So we define the end of their infectious period as being at least 10 days after the onset of their illness. And as long as their symptoms are improving and they haven't had fever within the past 3 days, we could assume that they're no longer infectious. So it's a bit tricky to identify exactly when the end of the infectious period is, but these are some of the markers we use to identify when someone may no longer be infectious. As you know, some people who are infected with SARS-CoV-2 may never develop any kind of symptoms. They are asymptomatic, but they can still be infectious. They could still infect someone else. For these people, it's more difficult to define their infectious period. It's more difficult to define when they could infect someone else. But typically, we assume this period to be about 10 to 14 days, and we should assume that it started before they had a test that showed that they had the infection and should last for at least 10 days after the test. So now let's think about the timeline of infection using these new terms that we've learned, the incubation period and the period of infectiousness. So here first, we see that someone is infected by someone else, and then they enter their incubation period. So the person is infected, but they haven't developed signs or symptoms yet. They may not know that they're infected. Remember, this incubation period can range from 2 to 14 days, but on average is about 5 days. The incubation period here is represented in the orange line. At the end of their incubation period, again, which will be an average of 5 days, but can be up to 14 days, they will develop signs and symptoms of disease. So for people who have mild illness, that illness is going to last about 7 days. For people who have more severe illness, that can last 2 weeks or more. Now let's think about when that person is infectious, or when could they possibly transmit the virus to someone else. So you can see here in yellow that this person who developed signs and symptoms here on day 14 was infectious starting from day 12, and they're going to be most infectious on the first day of onset of symptoms, which would be around day 14. So on the day that they first notice that they're sick, the day they first start feeling badly, is the day that they are most infectious or probably most likely to infect someone else. They can continue to be infectious throughout their signs and symptoms. This will be at least through 7 days, possibly longer. Particularly for people who have severe disease, they're going to be infectious for much longer and through the duration of their illness. So it's important to remember here a few key things. People can infect others before they become sick, before they know they're sick, and particularly on the day that they're sick. And they can continue to be infectious